Did you know that more than 90% of the world population is affected by acne at some point in their life? This means that if you are an acne sufferer, you are not alone. Having acne is something that a lot of us can relate to, myself included. I remember when I was a teenager, I would spend hours searching on the internet, trying to really understand what causes it and how to treat it. From taking supplements to trying different over-the-counter products, I remember the desperation I felt and wanting to get rid of it once and for all. So if you're looking to understand how acne is formed and what we can do about it, then keep watching as I walk you through how acne is formed in the first place and the treatment options that we have today that are available to combat this common skin condition. First, let's learn a little bit about what the skin does under normal circumstances. Our skin contains many little follicles, which we see as pores in our skin. These pores serve an important role of producing oil to create a barrier for your skin so that it can be protected from harsh environment. In addition to oil production, there's also turnover of skin cells during which skin cells on the top layer detach from each other and slough off, while the new skin cells at the bottom gradually make their way to the top and go through the same process again. When there is an overabundance of oil produced that's mixed with sluggish rate of skin cell turnover, the result is an excessive buildup of oil and dead skin cells in the pores, leading to congestion. When these pores have no openings at the top, we call them closed comedones, or whiteheads. And when these pores are open at the top, we call them open comedones, or blackheads. Blackheads are not black because of dirt. They take on this dark color due to oxidization of the substance inside the pore when exposed to air. Whiteheads and blackheads are not the only types of acne you can have. When congested pores becomes inflamed, a red pimple can form. Inflammation can be caused by bacteria that live inside your pores, but sometimes it can be due to hormone fluctuation and frictional irritation as well. So to treat acne, we need to examine the skin carefully and look for clues to the possible causes. For example, if the acne you have is predominantly whiteheads or blackheads, then you might want to use medications that help speed up skin cell turnover and dissolve the junk sitting in your pores. If you have red pimples on your face that would indicate inflammation, perhaps from bacterial infection, then you might want to use medications that kill bacteria and reduce inflammation. Sometimes mild cases of acne can be treated successfully with over-the-counter product, but most of the time the best way to get your acne treated the right way is to talk to your doctor about it. The problem with treating it yourself is that there are so many different skincare products out there that it's hard to know which ones to choose from. This will require a lot of trial and error. The other drawback of over-the-counter products is that they can contain heavy fragrance and other ingredients that can irritate your skin, and these can make it harder to get your acne under control. It doesn't hurt to get more information and get a second opinion, so don't feel like you have to wait until your acne is really bad to seek help from your doctor. Let's review the medications that are commonly prescribed for acne, starting with the topical treatment first, or the stuff that you put on your skin. One of the most common ones doctors prescribe is tretinoin cream or gel, which can effectively dissolve the black and white heads inside your pores and reduce inflammation that causes the red pimples. It comes in many different strengths, and the higher the strength, the harsher the side effects. The side effects can include skin dryness and irritation, but don't worry, the side effects can be expected to decrease with time as your skin gets more used to it. It should be noted that your skin might get worse before it gets better with the tretinoin cream or gel, so you do have to be patient as the result will not likely be noticeable until weeks after you started. This is something that you put on at night and not during the day, as it can cause sun sensitivity. It is usually recommended that you wear a sunscreen during the day while you are on this form of treatment. The other category of topical treatment is antimicrobial medications, stuff that kills bacteria. This would include topical benzoyl peroxide, sulfur, clindamycin, erythromycin, and dapsone. They are all used for the same purpose, to eliminate the bacteria that causes acne on your skin. Benzoyl peroxide is a common ingredient found in many over-the-counter acne products. Benzoyl peroxide can cause dryness and irritation of the skin, and just like the tretinoin, the higher the concentration, the worse the irritation. Sulfur is similar in that it also kills acne-causing bacteria, but has the added benefit of unclogging your pores. Clindamycin and erythromycin are both known more as oral antibiotics, but when used topically, it can be helpful to kill off acne-causing bacteria as well. Sometimes when the acne is bad enough, your doctor may suggest that you go on oral antibiotic. This is actually a pretty common treatment for stubborn red acne that just doesn't respond well to topical solutions alone. You might have heard of drugs like doxycycline, minocycline, Bactrim, and azithromycin. These antibiotics not only kills acne-causing bacteria, but also knocks down the inflammation in your skin, which is a nice added bonus. Usually you would need to take the oral antibiotic for at least 3 months to see how your skin responds. While they can be very effective in clearing up your acne, each oral antibiotic does come with its own set of side effects. Most of them do have the reputation of causing stomach upset and diarrhea. Doxycycline specifically can cause your skin to be very sensitive to the sun, causing a rash. So you do have to avoid sun exposure for the duration of the treatment. Antibiotics also have the bad reputation for killing off the good bacteria living in your gut and thereby shifting the bacteria balance in the wrong direction. Even though these side effects are unappealing, but the trade-off is that they do work quite well in getting rid of the red pimples on your face. Finally, the big gun, oral retinoid, also known as Accutane. It works by normalizing how fast your skin cells turn over, dissolving the black and white heads, and tame the inflammation on your skin. Sounds like a wonder drug, right? Well, such an effective drug does come with a price. It just so happens that this is also the most toxic treatment options out of everything we have just talked about. Not only can it cause annoying side effects like dry skin, dry eyes, hair loss, liver injury, and decreased bone density, it is also teratogenic, meaning that if taken during pregnancy, it can interfere with fetal development and cause malformations. This is why your doctor will ask you to be not only on 1, but 2 birth control methods while you are on this medication. And regular blood work will also likely be needed to make sure that this doesn't affect your other organ functions. It is a pill you take daily or twice a day, and you do have to be on it for 20 weeks total. It is a pretty big commitment, but worth it for so many people who are struggling with very severe forms of acne that has led to extensive scarring. Let's not forget about hormone therapies like birth control and spironolactone. These medications are great for people who get acne as a result of hormone balance, like when you have too much male hormones in your body relative to female hormones. These treatments are typically reserved for females only. Spironolactone is an interesting medication, even though it is technically a diuretic or a drug that gets rid of water from your body. It has this nice added benefit of blocking the effect of masculinizing hormones. I love it when medication has multiple uses, especially when they're totally unrelated. So acne is in some ways complicated, but also simple if you understand what causes it and select treatments to target the underlying problems. Hopefully, today's episode information has helped you understand more about your skin and how to take better care of it.